Well, good morning again. Thank you again for coming back. Hopefully yesterday you learned quite a bit, and hopefully today we'll also share a lot of knowledge with you as well. So yesterday we talked about the importance of understanding the cause or the function of complex problem behaviors, and how that information and knowledge is used to develop treatments for those complex problem behaviors. Today, I'm going to talk and focus on one of the most effective treatments for complex problem behaviors, which is called Functional Communication Training, or FCT. But before I get started, I do want to just go over a few things that we covered yesterday, just to make sure that you have a good understanding of this. And so, if you recall from yesterday, these complex problem behaviors are influenced by the antecedents as well as consequences. So the antecedents are those events that precede or occur just before the complex problem behavior, such as aggression, occurs. And so the antecedents will trigger the problem behavior. And the consequences immediately follow the problem behavior. And so they will refer to it as reinforce the problem behavior. So the example that I used yesterday was if we have somebody who engages in aggressions, so they hit you, the antecedent might be that we present a demand or schoolwork to them that they don't want to do. They engage in the aggressive behaviors, and they've learned in the past that when I am aggressive, people will stop having me do work and give me a break. And so they get an escape from the break there. So in that particular example, the antecedent is that the teacher presented the schoolwork. The behavior is the aggression. The child or the individual with autism engages in aggression. And then the consequence is that the teacher allows that student to take a break or escape that schoolwork there. All right. So again, when we look at the ABC contingency, we're looking at it because all of these complex problem behaviors are learned behaviors. And they learn these behaviors through how we interact with them, both in terms of those antecedents and consequences there. I also want to just go over the fact that we can generally categorize these functions or these causes of behaviors into these groups over here. So we can look at it in terms of positive reinforcement. Positive reinforcement would be something is being given to them when they engage in these problem behaviors, and therefore they will continue to engage in these behaviors. Examples would be that attention. So they engage in aggressions. We provide them with an attention, such as the reprimand of "don't do that," or "why are you doing that?" And then that's that reinforcer. Another example would be tangible reinforcement, where they get something for when they engage in those behaviors. So a parent might give them their favorite toys, their favorite food or snacks, to try to calm them down. And so unfortunately, the autistic person is learning that when I am aggressive, my parents will give me my favorite toy, my favorite game, or let me play my favorite game there. The other category is negative reinforcement. So negative reinforcement is that something is being taken away or removed when they engage in these behaviors, and therefore they will continue to engage in these problem behaviors. So the most common example of that would be escape. So when they don't want to do schoolwork, for example, when they don't want to do chores, go to work, they might have learned that when I am aggressive or when I punch somebody, my parents will let me take a break from doing any schoolwork or going to work or the vocational site there. And then the final category was what we refer to as automatic reinforcement. And that's the one where they're engaging in the behavior, self-injurious behavior, for example, because they're getting some type of internal stimulation, some type of sensory stimulation there. We don't know exactly what it is. They might be getting some type of relief from some pain, or they might feel good to them when they engage in those behaviors there. And so in order to identify the function or the causes of the behaviors, if you recall, we have that functional assessment. So yesterday, Julia went over the functional analysis with you, but the functional analysis that she showed you yesterday is one type of functional assessment that we have. The other types of functional assessments are indirect assessments and descriptive analyses. And so it's these three assessments that we will use to determine what the antecedents are and what the consequences are for those complex problem behaviors. And so we'll refer to that again as identifying the functions or the cause of the behavior. Now, what all of this, the reason that knowing what the functions of the behavior is so important, or knowing why it's so important, is that information is vital to developing individualized treatments. So without that knowledge, we're not able to develop treatments that are suited and developed specifically based on the needs of that particular person. And so essentially, we might be guessing as to what the treatment might be. And so this individual, knowing what the cause of the behavior is will allow us to develop that individualized and personalized approach to treatment there. And we refer to these treatments, so when the treatment is based on the cause or the functions of the behavior, we refer to those treatments as function-based treatments, right? So a function-based treatment would be a treatment that is suited specifically to that individual, and it's designed to address the function or the cause of the behaviors there, right? So if we know that through our functional assessments that the aggression is reinforced or caused by attention, then we will use that information to develop treatments to address that attention as a function for the problem behaviors there. Okay. All right. So let's start talking about some of these treatments, and I'll provide some example, or I'll discuss kind of like the range of treatments, but I'm really going to focus on one type of treatment for today. But first, there are. So if you recall, if we go back to the antecedent behavior consequence contingency, we could develop treatments that are designed to address the antecedent part of that contingency there. So, for example, if we know that when we present a demand or schoolwork or to the individual that will trigger the problem behaviors, then we can develop treatments for that antecedent or that demand. For example, we might do what's called a demand fading, where we remove all the demands so we don't present any demands, and then we gradually reintroduce the demands so that they might have to do one schoolwork or one task when they're at school, and then two tasks, and then 4 or 5, and so on there. So we gradually reintroduce the demands there. Another very common antecedent-based treatment, so a treatment based on treating the antecedent, is what we refer to as non-contingent reinforcement, or NCR. Non-contingent reinforcement would be we are providing that reinforcer or that cause of the behavior regardless of what they're doing, so independent of their behavior. So if we know that the aggressions are maintained by attention, so when they engage in aggression back at home, the parents give them lots of attention for it, and so the next time they want attention, they're going to engage in that aggressive behavior. So in order to intervene in the antecedent, we can then use non-contingent reinforcement, which would be just providing them lots and lots of attention at all other times, right? And the idea is that when we are non-contingently providing them with the attention, they are less motivated to engage in aggression to get the attention, right? So there's no need. So if they're getting just free attention all the time, there's no need for them to be aggressive to get that attention there. Okay. Usually with something like non-contingent reinforcement, it's something that we should all be getting anyways, right? Like we should all be getting lots of attention regardless of whether or not we ask for it. If you have children, you give them lots and lots of attention throughout the day, regardless of whether or not they're asking for it. And so ideally, people with autism should also be getting lots of attention throughout their day, regardless of what they're doing. Unfortunately, that doesn't always happen, though. So those are two examples of how we can intervene on the antecedent part of the three-term contingency or the ABC contingency. And when we implement treatments for the antecedents, the goal is to prevent the behaviors from occurring in the first place, right? So if we are providing that free attention, so we're just giving them attention all day long as often as possible, we're preventing the aggression from occurring. When we remove all the schoolwork and then gradually reintroducing it, we are preventing the aggressions from occurring there. So antecedent-based interventions are really, really excellent because they prevent the behaviors from occurring. Oops. Now really the focus of my talk today will be on treatments that target the consequence, right? So we've got the antecedent and then the behavior, but then there's the consequence. What happens after the behaviors occur? And so there are lots of different options for how to respond to the treatment. One is called a differential reinforcement of other behavior, or DRO. And that is when we are providing the reinforcer, let's say attention, contingent on the absence of the behavior. So if the child goes, or if the autistic person goes an hour without engaging in the aggressive behaviors, then we will make sure to give them lots of attention there. But if they engage in aggressions during that hour, we reset that DRO interval so that they have to always go an hour without engaging in the aggressions in order to get the attention there. So that's an example of a DRO. My favorite treatment is the differential reinforcement of alternative behaviors, or the DRA. And the DRA is we are reinforcing appropriate alternative behaviors to the complex problem behaviors. And so we will target a specific appropriate behavior to increase, and ideally, and that's designed to replace the problem behaviors there. And that's where functional communication training comes in, is that with functional communication training, we are teaching appropriate forms of functional communication so that they can learn more appropriate ways to get the attention, get the break from the demands, get those preferred games and toys and food and things like that. And again, I'm going to spend more time talking about the functional communication training intervention there. And then the final part of treatment, or function-based treatment, is what we refer to as extinction. So if we know that the aggression is maintained or caused by attention, then ideally we would want to stop giving them attention whenever they engage in the aggressive behaviors there, right? Because if we even if we use the NCR or the differential reinforcement procedure, the DRA, if they continue to be able to get attention when they engage in aggressions, then it's very likely that they'll engage in aggressions first to get the attention, because that's what they've been doing for a long period of time. So they've got that history of engaging in aggressions, so they will be more likely to engage in aggressions to get that attention, as opposed to a new, more alternative, appropriate behavior there. And so knowing what the cause or the function of the behavior is allows us to also make sure that parents, teachers, other staff try not to provide that reinforcer or that cause of the behavior for the problem behaviors. So if the person, we know that the person engages in aggression because they don't want to do schoolwork, then what we need to do, it's not always possible, but what we need to try to do is to not allow them to take breaks from schoolwork if they're aggressive. They can only take breaks from schoolwork if they appropriately ask for those breaks there. Okay, and that's what we refer to as extinction. So these three categories of treatment: the antecedent-based interventions, the consequence-based interventions, so there's differential reinforcement, and then extinction, that we can all use as a part of a comprehensive treatment. And so in most cases, when we develop treatments for problem behaviors, it's not just one treatment. It's most likely a collection or a combination of of these different components that form this comprehensive treatment plan. Okay, so and it can be a bit complicated. Okay, so let's talk about functional communication training, right? So for the rest of my talk, I'm going to focus on functional communication training, or we also refer to it as FCT. It's just a little bit quicker to say that way. So FCT is a specific type of differential reinforcement of alternative behavior procedures, right? So I mentioned that DRA procedure. FCT is a very specific type of DRA procedure. And FCT is considered one of the most effective treatments for these complex problem behaviors there. And what it basically involves is teaching the person an alternative, more appropriate way to get the whatever the consequence is or whatever the reinforcer is. And the idea is that we are replacing the problem behavior with the functional communication, the more appropriate response, so that they don't need to be aggressive to get somebody's attention. They can raise their hand, they can say, "Excuse me," they can perhaps tap you on the shoulder or hand you a picture card. Lots of different alternatives there. Okay. If we know that the aggressions are maintained by escape from demands, we could teach the person to appropriately ask for breaks rather than becoming aggressive to get those breaks. So we can teach them to perhaps sign finished or to say, "I need a break, please," and so on there. So I'm going to also make sure to provide you with some research that underlies everything that I'm going to talk about today. In this particular study here, published in 1985 by Durand and Carr, Ted Carr and Mark Durand, this was the first study that was published on functional communication training, or FCT, right? So this is a very important paper within the field of applied behavior analysis. And what they did was they conducted a functional analysis, right? So they made sure to figure out what the cause of the behavior was. And what they found is, these were done with younger children in the school, and what they found is that these children's aggressions were maintained by extra attention, or some children engaged in aggressions maintained by attention, and then other children engaged in aggressions maintained by escape, right? So that is that there were some students who had learned when they're aggressive, they will get some extra attention, and there was other students who learned that when they were aggressive, they would actually get extra help from the schoolwork, right? So that they didn't have to do it all by themselves. And so what they did is, I know this is a pretty complicated diagram, but I just want you to focus on this. So for those students who engaged in the escape maintained behavior, right? So those kids who had learned, when I'm aggressive, I don't have to do as much work. I'll get some help on that. Durand and Carr taught them to say, "I don't understand," right? And so that was a cue to the teacher to provide help with the schoolwork there. And so the "I don't understand," the appropriate response is what we refer to as the functional communication. So that's the functional communication response that's very important to this particular treatment. Now, for those children who wanted some extra attention during school, what they did is they taught the students to ask the teachers, "Am I doing good work?" And so that was a cue for the teachers to give them lots of attention for doing some extra to work, to provide that extra attention there. All right. So again, for those students who engaged in escape maintained problem behaviors, they taught them to ask the teachers, "I don't understand," so basically asking for help. And for those students who engaged in the attention maintained behavior, they taught the students to ask for more attention by saying, "Am I doing good work?" All right. And so those were the functional communication responses, and those functional communication responses were designed to replace the aggressive behaviors there. Okay, I know this looks really, really complicated, but I just want you to focus on these. And the main reason I show you these is the closed circles, or the lines represent the the level of aggressive behaviors there. And then the bars represent the level of the appropriate functional communication response there. And so these are all the treatments, and this is exactly what we would want and expect to happen, is that once we've taught the people or the autistic person that the appropriate functional communication response, we will see an increase in that functional communication response and a decrease in the complex problem behaviors, in this particular case, the aggression there. And so in all cases, in all repetitions of this, they found that with their students, when the students learned to engage in that appropriate functional communication response, they used it very, very well, and that resulted in a decrease in their aggressive behaviors there. And so this was, again, the very first study that in 1985 that coined that term, functional communication training. And since this particular study, there have been hundreds of studies looking at functional communication training as a treatment for a variety of different problem behaviors, as well as a variety of different populations, not only autistic people here. Let me show you a video. So this is, you'll remember this video from yesterday. So this was that teenage boy from like the rural part of Missouri. If you recall, he was very aggressive. This is actually a part of his functional analysis. So what we learned is that whenever we tried to get him to engage, do any type of schoolwork, he would immediately become aggressive. And he had a very long history of doing this. I mentioned yesterday that his school, they had two staff standing at the door. He was by himself in a large room. They never did any schoolwork because this patient had learned, when I don't want to do something, I become aggressive and the teachers leave me alone. And actually the teachers learn it's better off to just leave them alone, or otherwise they might get hurt. So this is the video here. With sound. So I'm approaching him, trying to get him to stand up because I want him to sit at the table to get ready to do some schoolwork there. And so again, he has learned that whenever somebody comes up and asks him to do something he doesn't want to do it, all he has to do is to become aggressive, and we will leave him alone.
Stephen, stand up. Uh-oh. 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 Standing up. Let's go. Uh-oh.
Okay, so very, very aggressive, and he's very good at escaping demands there. All right, and so this was before we implemented functional communication training. This was our functional analysis. Like we spent a lot of time trying to determine what the cause of the behavior is, and then we started functional communication training. Okay. And again, these videos are just snapshots, like the worst case in the beginning and then the best case in the at the end. But lots of things happened in between, some great, some not so great. And it did take quite some time here. And so here what you'll see is this is after a very long period. I can't remember exactly how long, but probably weeks and weeks of using functional communication training. And what we did was, he was nonverbal, and so we used a picture card as his functional communication response. And so we taught him to hand us a picture card when he wanted, or actually I think it was handing us a picture card when he wanted to take a break, when he wanted to stop doing any schoolwork. All he had to do was hand us this picture card, and we would leave him alone, and there was no need for him to engage in aggressions. But we also did was that extinction part that I mentioned earlier, right? So what we also taught him is that if he is aggressive, we will not let him take a break. We will continue to have him do the schoolwork because we're trying to teach him the only way that he can get a break from doing schoolwork is to hand us that picture card, that functional communication response there. Okay, and so this is near the end. What we've done is initially, whenever he asked us to take a break, we would always give him a break. But that can't happen in school. In school, he's there to learn, and so he has to learn, has to do some schoolwork. And so we gradually increased the amount of work that he had to do before he could ask us to take a break. And this was closer to the end where he had to do 10 demands, very simple tasks. I think this was doing a puzzle. And then he could appropriately ask for a break. If he didn't do those 10 tasks, he didn't have the opportunity to ask for a break. All right, so this is my colleague Casey walking him into the room. Okay, and I also want to point out this was his parents told us this is the first time that he had ever sat at a table to do any schoolwork. His school never was able to do that. Oh, where's the sound? I'm sorry, I don't know where the sound is on this one. I think it's my mistake. Sorry about that. But what Casey in the blue shirt is doing is he's getting the token board ready because that token board is helping the patient know how many demands he's done and once he's reached the 10 demands there. Casey is now presenting a simple puzzle, so it's just putting the puzzle piece in the puzzle. And then this is the last demand, the 10th demand there. So once he completes the 10th task, that last task, you'll see the red card on the table. It's a stop sign. So he's completed the 10th task. He's going to grab the picture card, hand it to Casey, and Casey's saying, "That's awesome. Of course we can take a break." And now Casey is waiting for the patient to start walking out of the room there. All right. Again, this took a long, long time to get to this point. And we all had a lot of bruises, a lot of cuts, and had a lot of shirts ripped. But by the end of it, he was sitting at the table doing work, and something that the school had never been able to do with him. And he was very happy. He really enjoyed the interactions with our staff as well there. Okay, so this is just one example of the use of functional communication training. There's lots of different variations. Again, it's a very individualized approach to treatment. All right, so I mentioned that there have been hundreds and hundreds of studies looking at functional communication as a treatment, and so just to kind of give you an idea of the efficacy of FCT as a treatment, this review was done by Kurtz and colleagues a little while ago, and they were basically looking at the research on functional communication training and whether or not it met the criterion for empirically validated treatments there, right? So they looked at the research literature that looked at functional communication training, and they conducted a systematic review in order to determine whether or not this met the scientific criteria to be an empirically validated treatment. For this study, they found 29 studies, and the criteria was at least 9 particular case studies, a clear description of the procedures, and then a replication of the effects as well. And what they concluded is that FCT is a well-established treatment for problem behaviors exhibited by autistic children. Okay, so all the research shows that FCT is a well-established treatment for problem behaviors exhibited by autistic children. And what they also found is that FCT is, the term is probably efficacious for the treatment of problem behaviors exhibited by adults. The only reason, the primary reason why it's not well established for adults is that there's not a lot of research with adults. So there's far more research with children than there are with adults. So there just weren't enough studies to conclude that FCT is an effective treatment for adults. but that's purely because there's not a lot of research being done with adults. In another review paper here, Griffin Rooker and his colleagues conducted what's referred to as a consecutive case review. And so this was done at the hospital that I mentioned yesterday, the Kennedy Krieger Institute, the neurobehavioral unit, which is that inpatient unit for children with autism who engage in those really severe complex problem behaviors. And what they did was they looked at the medical records of 58, I think it was 50 patients, 50 patients, to see over a specific time period. So all of the patients in this specific time period, they evaluated how well functional communication training worked. And what they found is that FCT was highly effective in reducing these complex problem behaviors. Just to explain what this particular graph is, the highlighted section there would be the percentage of times that they used FCT in which there was a 90% or greater reduction in behaviors as compared to baseline, or an 80% reduction or greater in behaviors there. So what you'll see is that in the vast majority of the cases or the patients they had seen over their time period, FCT was very effective in reducing the complex problem behaviors. Right? Usually at least 80% reductions, in many cases a greater than 90% reduction in problem behaviors there. Okay, so let's talk about how FCT is done, right? So now we know that functional communication training is one of the probably one of the most popular treatments for problem behaviors, complex problem behaviors. We know that there's a lot of scientific research that shows that FCT is a very effective treatment for these complex problem behaviors for autistic people as well as other populations as well. Now let's talk about some of the parameters under which they're done here. So when we implement functional communication training, there are several different steps or considerations that we need to make. So the first is to conduct a functional assessment. So remember that I mentioned that FCT is a function-based treatment. And so therefore, in order to use FCT, we need to know what the function of the behavior is or what the cause of that behavior is. And so we need to conduct that functional behavioral assessment, like that functional analysis, in order to determine the cause of the behaviors there. Excuse me. Once we know what the function is, we then start collecting baseline data, right? So pre-treatment data, so that we can use that information to compare our treatment outcome. Next, we determine the form of the functional communication response. So what is the appropriate response that we're going to teach to replace the aggressions there, that functional communication response? And there's lots of different lots of different types of functional communication responses that we can use. If the person can speak, we obviously want to use their vocal speech if possible. But we might have to use alternative forms of communication, picture exchange, sign language, iPads, or tablets and things like that. Once we've figured these out, then we're ready to start teaching that functional communication response. Okay. Once we've taught that functional communication response, we then evaluate whether or not FCT is effective. And then the final step, which tends to be one of the most challenging steps, is to what we refer to as thin the reinforcement schedule. All right. So when we teach that functional communication response, we will teach them so that they get lots and lots of reinforcement. So if we know that attention is the reinforcer or the cause of aggression, we may teach the person to raise their hand to get our attention. But early on, every time they raise their hand, we will give them lots and lots of attention there. So they raise their hand, we give them lots of attention. They raise their hand, we give them lots of attention, because we want them to learn that raising their hand gets them lots of attention. And in order for them to learn, they have to experience the consequences as often as possible there. But that is not practical, right? So a parent at home cannot constantly attend to the child all day long. The teacher in the classroom cannot constantly attend to the child all day long, because there are many other children in the classroom as well. And so we will then thin that reinforcement schedule, which means that we will gradually decrease the amount of times that they will get the reinforcer or that consequence for engaging in the problem behaviors. And I'll spend more time talking about that because that is a very important part of functional communication training. Now, how do we go about teaching that functional communication response? There's lots of ways. I suspect that many of you already use a lot of different teaching strategies to teach new skills, right? So when you teach the people that you work with how to mand, for example, how to request for preferred items, you will most likely use teaching strategies that might include prompting, chaining, and shaping there, right? So like we know how to teach new behaviors through our various procedures that we have. And so the functional communication response is simply another new behavior, appropriate behavior that you will use, whatever your teaching strategies are, to teach up to the person with autism there. Okay, and here's one example of us having used shaping. So this is that same patient that I showed you earlier. That patient, those videos that I showed you were based on his aggressions being caused by escape from demands. But what we also found through that functional assessment is that he was aggressive because he also wanted to get our attention as well. So he really liked to throw the ball with us. And so he had learned also that when he is aggressive, people will come and give him attention and interact with him there. And so we, in that first series of two videos, I showed you, we had taught him to hand over that stop card to get a break from the demands. In this teaching session, what we did was we taught him to hand us a picture card to get our attention so that we would play with him there. And what you'll see is that we used a shaping procedure where we started from the easiest response possible, which is the big, play pictures. We put them on the floor so that all he had to do, he liked to sit on the floor. All he had to do was just touch the card, and we would start playing with him, giving him lots of attention and everything like that. Once he mastered that as a part of shaping, we then gradually made it more and more difficult, but more naturalistic. So the next step you'll see in the video is that he had to walk over and touch a big play card that we had put on the walls. So again, still relatively easy, but a little more effortful on his part. And our final goal was to have a small card attached to a lanyard on his belt so that he could walk around, walk to his parents or to the teacher and hand them the card, right? And so that is similar to a situation where a young child is walking up to their parents and saying, Mom and Dad, can we do this? And so on, right? What we didn't want is for the caregiver to walk up to him and ask him what he wanted, because the more naturalistic functional communication response would be for him to walk up to you and hand over his picture card there. Okay, and so you'll see like 3 series of steps here. So this is the first step. Okay, that's Annie, the staff person. Oh, I'm sorry, the picture card is on the wall. And all he has to do is just simply touch it. Sorry. Annie provides wonderful attention. So all he has to do, again, initially we wanted it to be as easy as possible for him so that he's going to do it a lot.
Good job, Steven! Oh, good job, Steven! You did such a good job! Hello! High five! Yes, Steven, you're doing so good. I like how you're hanging out so nice.
Okay, so then the next step is, that's right, handing it over. Right, so it's still the big card, but we want him to learn that exchange. So he's got to give this card to the person. That's Brad.
Go, nice job, Steven. There it is to you. Right back at you. Good throw. Let's play catch one more
Right, so
time.
hopefully you can see how we're shaping the behavior from a very, very easy response, but to our ultimate final response of what we want him to do when he's with his parents and at school there. and this is the final response there. So this is our goal of what we want him to do. So you'll see that he, with his left hand, he's grabbed his picture card, and he's trying to give it to Annie. But what we don't want Annie to do is to walk over and get it. He has to walk up, or he has to approach Annie to give that, because that is just the natural. That is what's going to happen when he goes home and into the school there. So Annie's not going to walk over and grab it from him. He's going to walk over, or he's going to scoot over to her. Okay, so you can see how we started from something that is the easiest response for him to learn, and gave him lots of wonderful reinforcement of attention. But we gradually shaped or changed that response so that it becomes what we ultimately want him to do when he's at home or at school, which was reaching to his belt, grabbing the card that was on the lanyard, and then walking over to the caregiver and handing over the card there. Right, so hopefully you can kind of picture what should be happening, when he's in school or in the classroom. That is how he should be giving people attention. What we don't want is that the teacher or the parents will walk up to him and prompt him to hand him the card, because that's not very naturalistic there. Okay. Oh, and then we also put it on the lanyard, like the little clip in there, so that he doesn't lose the card. Right, so it's always with him, so that he can always talk with that card there. Okay. Oh, sorry, this is the same video. Okay. So that was just one example of a teaching procedure that we can use to teach this functional communication response. Again, there's no one way to teach the functional communication. There's lots of different ways. Like whatever is successful for you, whatever is successful for the people that you work with, you should use to teach up that functional communication response there. All right. Now, there are two other components or steps to functional communication training that I think are probably more difficult. And not to say that teaching the FC response is easy, but I think there are two components that are really kind of difficult to figure out, and so I want to spend more time talking about it. Oh, I should have also mentioned in that video, again, these are just snapshots, so it looks like things are really, really easy. But there were lots and lots of teaching sessions that were done over several weeks. So I think it took, I don't remember exactly, probably like 3 weeks to get to the point where he was touching the card on the floor, touching the card on the wall, handing the big giant card, and then walking over and doing that, right? So it's not something that we taught him overnight. It took lots and lots of time. And he came in every day, I think in the mornings or afternoons, and we really did an intensive treatment there. Okay. All right, so I want to focus on two of the other components that can be really, really difficult to do or to kind of figure out. One is to, how do you identify what that functional communication response will be, right? So I mentioned that the form of communication can really vary based on whatever the needs of the person are, right? So it could be, if the person can talk, they can talk and ask for something. It might be, as in this patient's case, handing over a picture card. It could be using sign language, to get what it is they want. Or nowadays, I guess, using the iPad with the pictures on the icon or the iPads there. So there's lots of different ways, and so I think that can also oftentimes be confusing to try to figure out, well, like, how do we start? Like, what should the functional communication response be? And so I'll talk a little bit about that. But then the other question is, I mentioned that, when we first start teaching this functional communication response, we give them lots of reinforcement, and we always give them that reinforcement, right? Because we want them to know how wonderful, handing over that picture card will be. And so we need to make sure we give them lots and lots of attention there. But that's not possible at home or in the school. And so we need to thin that FCT schedule so that it's a little more naturalistic. It's something that the caregivers can do at home or in the school or the employment site there. Okay, so I'm going to talk about these two different components of functional communication training. Okay, so let's first talk about how we go about identifying the FC or the functional communication response there. So again, there is no one right answer to this. There are lots of factors. It depends on the person. It depends on the context. It depends on the environment. That's generally the case with anything that we do with the population that we work with. Is it depends. But what we can do is, we can kind of look at, well, should we use what we refer to as a topography-based response, and I'll explain what that is in a sec, versus a selection-based response. Okay, a topography-based response versus a selection-based response. So a topography-based response are those in which the form of that functional communication response differentiates from one to another there, right? So all the different ways in which they communicate are different from one to another. So a great example of a topography base would be using sign language, right? Sign language, there's lots of different ways that you need to move your hand in order to communicate there. So these are all different topographies of behavior in order to communicate there. The other option is that selection-based response there. So selection-based responses are those in which the form of the response is identical, but the stimulus that they select is different. So the topography-based response, all the forms of communication are different. So sign language, again, if you think about it, all the different forms, how you move your hand is how you communicate. But with the selection-based response, there's only one form of the response, but you're choosing different things there. So, for example, picture cards would be an example of a selection base, right? You have one response where you're grabbing the picture, handing it to the person, but you need to select between a variety of different pictures that have different meanings or outcomes there. Okay, so like here's an example of like a picture communication or selection-based communication, because the person simply has to grab something and hand it to the person. So it's the same form of the response, but they need to select which card to pick up there. Right? And so they're very different because some people might be really, really good with the topography-based responses, whereas other people might be better with the selection-based responses. Topography-based responses requires a lot of different motor movements, so oftentimes that could be difficult to teach someone with autism, particularly if they have more severe autism. Whereas selection-based requires like more scanning. So you need to know the difference between this picture versus that picture versus that picture, which might be difficult for, again, for some people with more severe autism to do there. Okay. All right. So one of the I'm going to talk about a few of the considerations to make when deciding what type of a functional communication response to use. One of the most important considerations when selecting that FC response is response effort. So how hard is it to use that response, right? And so the more difficult or effortful that response is, the harder it will be for that person to learn and to continue to use. And so the opposite is, the easier that response is for the person to use, the more effective functional communication will be, right? So with that patient that I had mentioned earlier today, we had to start from that really, really easy response of simply touching that big card and gradually shape it to the much more effortful response of grabbing the card, walking over to the person, and handing it to the part, right? So that simply touching the big card was really, really easy, less effortful. Walking over, handing and grabbing my card and handing it to the person is much, much more effortful there. Okay, and so that's I think a really good example of how response effort plays a very important part in this. If we had simply started by trying to teach him from the very beginning to grab that card that's on his belt, walk over to the person, and hand it to the person, we would likely have failed. Well, I know that we would have failed because he would never have learned it. Just because it is a very effortful and a very difficult response for him to learn there. And so that's why we started with that less effortful, easier response of touching that big card that was all over the room or on the floor there. Okay. And so just to show you some of the research that shows this, that the less effortful responses are probably better than the more effortful responses. This was a study published a while ago, early 2000s by Dave Richmond and some of his colleagues there. And what they did is they taught their participant two different functional communication responses there. All right, so one was a less effortful response of saying please. So this was someone who was vocal, and so the less effortful response was just simply saying please, versus a more effortful response of handing over a picture card. All right, so effort is, here we're talking about, comparing one effort in terms of, one's easier than the other. And so these are data, I'm just going to orient you a little bit to the graph over here. The y-axis represents the responses per minute of the problem behaviors, right? So how often did these problem behaviors occur? The y-axis represents each session. So each session was, about 10 or 15 minutes long. They repeated the sessions over and over again, so they can see the outcome over a period of time there. And what they found was that when the FC response was that more effortful response of handing over the card, it was still effective, right? So they were still able to teach them to hand over the card, what they found is that they would continue to the open circle represents how often they handed over the card, the functional communication response, and so when they were required to hand over the card to get the reinforcement, they would do it, and what that resulted in is low levels of problem behaviors there. Again, exactly what we want. Now, when they use the easier response, the less effortful response of saying please, again, they saw really high rates of asking for please, which is great. That's exactly what we want to do. And you'll actually see is that their functional communication response was higher. So they said please more often than they did the more effortful response of handing over the card, which makes sense. But then they also saw that the problem behaviors were lower, right? Again, this is exactly what we want. We want lots and lots of functional communication, and we want low levels of problem behaviors there. All right, so that was great. Now, what they did at the end is they wanted to compare. All right, so when we give that child the option of you could either ask us by saying please, or you could hand over this card. So you have this choice. You can say please, or you can hand us this card. It's up to you how you communicate with us, but either way, we'll still give you that reinforcement. What they found is that this particular child chose the easier response. So the child liked to do favored that easier response of saying please, as opposed to the more difficult response or effortful response of handing over that picture card there. Right? So you see lots and lots of appropriate functional communication, but it was always only saying the word please, which is easier. And again, you see, really nice low rates of problem behaviors, which is exactly what we would want with functional communication there. And so what these data show, I think very nicely, is that, ideally we want to try to pick the least effortful response that we can, because it makes sense. We all want to try to do the easiest things if possible. And so it's no different for this particular population there. So when you're selecting a functional communication response, try to choose what is likely to be the least effortful or the easiest for the child to do there. Okay. All right. Now, another variable to consider when when using functional communication training is social recognition. So it's essentially what I'm referring to as a listener's behavior. So you want to make sure to select a response that as many people as possible will understand. All right, and so there are likely times when the person will go into the community. And they will communicate to someone in the store, let's say the clerk in the store. If they're using a form of functional communication where that clerk in the store doesn't understand, that clerk will not be able to provide whatever that reinforcer is, right? As opposed to if the autistic person is using a functional communication response that everyone can understand, then that clerk is more likely to be able to provide that reinforcer there. Okay, and so what we find is that these the responses that more people are able to understand will lead to a more durable communication, which means that they are more likely to engage in that functional communication across a variety of different locations, across a variety of different people, in a variety of different situations and environments and contexts there. All right, which is exactly what we want. We want that person to be able to use that functional communication response outside of the hospital setting. It's wonderful for you to be able to teach that functional communication, and they're using it in the hospital. But if they leave the hospital door, go into school or into the store, and they're not able to use it, then it's a failure. All right. And so what this means is that there might be some forms of responses that are more suitable for social recognition. In particular, that selection response, or the selection-based FC response that I mentioned there. That selection-based FC response was, for example, the picture card, right? You hand over a picture card to somebody, even if it's a complete stranger, someone who has no idea what autism is, that picture card will have a word on it and a picture on it, and so that clerk can understand what it is. If it's some other type of augmented assisted device, perhaps you press a button and it says something, right? It's an iPad that says something. Again, that allows lots of other people, including strangers, novel people, to understand what the response is, as opposed to that topography-based response that I mentioned, where you have to actually use different forms of communication, like sign language. Not all of us know sign language. I know maybe 4 or 5 different signs, like break, eat, and those types of things. Beyond that, I don't know sign language. Most people out in the community don't know sign language. So if a person with autism had learned functional communication, but they go to the clerk and use sign language, most likely the clerk will not understand what that response is and not provide reinforcement, and therefore we might see more problematic behaviors there. So this is, again, a nice study that demonstrates that. This is Durand. He was one of the people who first talked about functional communication training. And what he wanted to do is to show that if you, the form of that functional communication response is important, because if it's something that everyone can understand, then that means it's those people in the people, it'll generalize to people in the community who have no idea what autism might be there. And so these are the data from that. And so this is actually the third part of their study. And what they did is they had their participants go into the community. You'll see the descriptions of where they went, and to engage in that functional communication response, right? So there was a staff person with them, but the staff person wasn't really doing anything. It was the person with autism had to go up to whoever the person was, the novel person was in the community, and engage in that functional communication response there. Right, so it's important to understand that the people that these autistic people walk up to were just regular community members. They didn't know the autistic person. It's not like they worked with them or anything like that. And so the community members were able to respond and reinforce the functional communication response, which is the bar. The bars would be like the level of the child engaging in the functional communication response. And what you'll see is that the children continue to engage in that functional communication response when they're going out into the community, communicating with complete strangers. I'm sorry, I should have said that the functional communication response in this particular study were like communication machines, devices. So they had to press the button, and then there was a voice output. So it said whatever it is that the communication was intended for. Okay. So again, that's an example in which they press a button, it says something, and then most of us will be able to understand what that something is. And so what they saw is that that functional communication continued to occur because people in the community continued to provide reinforcement, continue to acknowledge that functional communication response. And then equally important, but what they saw is that because that functional communication response continued to be reinforced, problem behaviors continued to occur at low levels there. right? So this is, again, the ideal pattern that we want is we want high and consistent levels of that functional communication and low levels of the problem behaviors, that complex problem behaviors there. And so these data suggest that, selecting functional communication responses that everyone, including people like novel people in the community, can understand, rather than those functional communication responses that might be very specialized, like sign language, is probably a better way of using functional communication training there. All right. So far we know what we've talked about is, we want ideally select FC responses that are less effortful. But now we also want to make sure that we are selecting functional communication responses that many people can understand, or most people can understand. Now, the third category, or the third step, or variable to consider when selecting functional communication response is, how easy is it for them to learn? All right. So I showed you in that video in which we shaped up that picture exchange. It took a long time. Right, and fortunately, we had a lot of time. We had a lot of wonderful staff who were experienced in doing this, but you might not necessarily have all that time, and so the ease or speed of acquisition of that functional communication response is an important variable to consider. And so, vocal responses like saying the words might be a great response to use. But for some people with autism, it's a difficult response to learn. So you might have to use something like picture communication cards because that's an easier thing to learn. And here's a study by Winborn and colleagues back in the early 2000s. And so what they did is they wanted to compare two different types of functional communication responses. One is a response that they already knew how to use. They just didn't use it at the appropriate time, but they knew how to use it, but they didn't use it appropriately, versus teaching them some brand new functional communication response. And so for the top participant, Ike, the FC response that they already knew was saying no, right? So the person was, already had a history of saying no, so they didn't have to teach it. They just had to teach the participant that, well, you used no in this particular context appropriately, versus the novel or the new functional communication response was teaching the person to say break, please, right? So this is saying break, please was something that the person had never done before. So these experimenters decided they wanted to teach them how to do that there. Oh, sorry. And so what they saw is that the left graph is something that they already knew, so saying no, and then the right graph would be that new novel response, which was saying break, please there. And you can see that again, with this last phase is when they gave them the choice. I'm sorry, let me just orient myself to the graph over here for a second. Okay, so in the upper left graph, when they used no as a functional communication response, they found that it was very good. They consistently used that response, and it decreased the problem behaviors. And then after they taught the person to say break, please, they found that they consistently used that FC response, and that decreased problem behaviors. But in this last phase that I've highlighted, what they did is, again, they compared the choice between saying no versus saying break, please there, right? So saying the response that they already knew versus the new response there, right? So they gave them that choice. You can either say no or you can say break, please. And what they found is that when they had that choice, the participant preferred to say the behavior, the FC response that they already knew. So saying no, which is the left graph. So in the left graph, you see that they are always saying the no. In the right graph, and similarly, that means that they are not saying the break, please there. Same thing goes for the bottom participant over here. For the bottom, the existing one or the already known FC response was saying all done. And then the new novel response was saying break. And so what these data highlight is the fact that when given the choice, autistic people are more likely to choose something that they already know because it's easier to implement, it's easier to learn in that particular context there. Okay, so what's the best FC response? Well, so there's really no right answer. It really depends on the individual. As is the case with everything that we do with our autistic individuals, it depends on the individual, it depends on the context, and it depends on the environment. But we do know a few different things, like general things that will help guide us in terms of selecting the FC response. One is that we know that FC responses that are easier and less effortful to do are better than those that are more difficult to do. We also know that we should select responses that are easily understood by others, right? So including like novel people or new people. So ideally we want to choose FC responses that everyone can understand, because that means that there's a greater likelihood of reinforcement. And finally, we should try to select FC responses that the person already knows how to do. So this would help us in terms of speed of acquisition. So the person will be able to learn when to use that response more quickly. And we also find that they'll probably prefer something that they already know versus having to teach a new response there. All right, so these are three different variables that we know, or considerations that we should take in when we try to select the functional communication response. Okay, so let's move on to that other special consideration when using functional communication training, which was thinning that reinforcement schedule. All right, so again, just to remind you, thinning the reinforcement schedule, it basically means that we're trying to make the treatment easier for everyone there. Right, so initially we're providing lots and lots of reinforcement. We are, every time they're engaging in the functional communication response, we're providing reinforcement. That is not realistic. Right? Parents can't do that all the time. Teachers can't do that all the time. Therefore, we need to thin that reinforcement schedule so that they're not getting as much reinforcement there. So after we've taught that individual to emit that functional communication response, the goal, as well as to reduce that complex problem behaviors, our goal is to make things easier by thinning that reinforcement schedule. The rest of my presentation, I'm going to talk about schedule thinning as well as variables to consider with schedule thinnings there. So there are a couple of different ways to go about thinning that reinforcement schedule, and again, it depends on the context that you're in. The first is what we refer to as multiple schedules. So technically speaking, multiple schedules would be, there are two different schedules in place, and they alternate sequentially with one another. When one is done, then it switches to another. I know that sounds very confusing, but it's basically having periods of reinforcement and having periods of no reinforcement. So with multiple schedules, what we're doing is we're teaching the autistic individual that there will be some times when you raise your hand that we will give you attention, but there will be other times when you raise your hand that we will not give you attention. Therefore, during those times, there's no need for you to raise your hand or engage in that FC response. All right? So we're teaching the person that really you should only engage in the FC response during certain times, and during other times, there's no need to engage in that FC response there. And so that's what we refer to as that multiple schedule there. And so what we're really trying to do is to teach that person to wait for reinforcement. So it could be that, for example, in the classroom at school, the teacher is available to work with that student. So then the student can raise their hand, hand over the picture card, say hello, whatever the FC response might be, and that teacher can provide lots and lots of reinforcement, lots and lots of attention, for example, at that time, for let's say 15 minutes or so. But then once that 15 minutes up, the teacher has to then go back to all the other students. So the student has to learn, or that autistic child has to learn, that during that other time when the teacher walks away, that I can't keep asking for attention. I can't keep raising my hand because the teacher's not available to provide that attention there. All right, so using that wait duration. So here's a study, one of the first studies that looked at schedule thinnings by Greg Hanley and some of his colleagues. And what they did was, they looked at several different ways to thin that reinforcement schedule. One was using that multiple schedule. And what they did is, again, using that multiple schedule, they alternated periods of time in which, FC response resulted in reinforcement, and then other periods of time in which, if they engaged in that FC, there was no reinforcement. So there's no need to engage in that FC response during those times. And so what they found is that initially, just to highlight this particular graph over here, they started with what we refer to as the FR1 schedule, which means that every time the person engaged in that FC response, they got the reinforcer, all right? But they gradually thinned that schedule to the point where the person had to wait 240 seconds before they got the attention there. Oops, sorry. And what you'll see that down here is the schedule of thinning, and there are lots and lots of different steps to that there. So it's not the case that they went from lots and lots of reinforcement to very, very little reinforcement. What they did is they went from lots and lots of reinforcement to a lot of reinforcement, to a little bit more reinforcement, to a little bit less reinforcement, and even less reinforcement, and then very, very few reinforcement there. So it was a very gradual process. And you can see it took multiple sessions to get to that point where they provide lots of reinforcement to very minimal reinforcement. And what you'll also see is that the squares, the open squares represent the communication, that functional communication response, and they continue to engage in that functional communication response, which is exactly what we want, right? So even though we're not going to reinforce as often, we still want you to do it when it's appropriate. And they also engaged in low levels of problem behavior, so the ideal outcome there. Now, the other thing to point out in that Hanley study is that in order to help the subject or the participant understand when they can reinforcement was available and unavailable, right? So like when they should and shouldn't engage in that FC response, they use what we call a discriminative stimulus. That discriminative stimulus signals the availability and the unavailability of reinforcement. And so they're just in that Hanley study, the discriminative stimulus was, I think it was a card or a white card with a shape. And then if the white card was on the table, that meant that if you engage in the functional communication response, you will get reinforcement there. So that means that's reinforcement is available. And then alternatively, when reinforcement was unavailable, there was a red card. And so the red card would signal to the individual that if you raise your hand, you're not going to get reinforcement. So there's no need for you to raise your hand there. All right, so it's that what we refer to as that discriminative stimulus that cues when reinforcement is available and unavailable, and that's used to help the autistic person throughout that whole schedule thinning process there. And that was just one example of discriminative stimulus. There's lots of other examples of how you can kind of signal the availability and unavailability. I've seen people use lanyards, right? So if I'm wearing a lanyard, that means that I can come. You can ask to talk to me, or you can engage me. But if I'm not wearing a lanyard, that means I'm busy and you have to leave me alone. It could be a wristband. If I'm wearing a wristband, that means that yes, I'm open, available to talk. If I don't have the wristband, then I'm not available to talk or provide reinforcement there. Okay. I also want to just show you some data over here. The other way that we can use discriminative stimuli is to teach the person to attend to the naturally occurring cues in the environment there, right? So like, when when we're around, like we know when someone is busy and when someone is not busy, right? So if I am sitting in my office, typing on my computer, and it looks like I'm doing lots and lots of work, then a student will know that I'm busy and they probably shouldn't interrupt me at that time. If I'm on the phone, or if you're on the phone, I'm talking to somebody, then that's a signal that you're busy and you probably shouldn't be interrupted at that time. If I am sitting down and just scrolling through TikTok, then that's probably a sign that I am not busy and it's okay to come talk to me or interrupt me there. Okay. And so we did a study. This is a case report. A student, Caitlin Balka, this was her master's thesis. And what we did was we wanted to teach an autistic person, like after we had taught them or used functional communication training, we wanted to teach them to attend those naturally occurring cues to know when we're busy versus not busy. So like when to approach us for reinforcement versus to leave us alone because we're busy and we can't attend to you right now there. And so the cues that we wanted the person to attend to was when we're busy, the person is pretending to be working, or they're talking to somebody else, right? If I'm talking to somebody else, then the child with autism or the autistic person probably shouldn't be coming to interrupt us there. So that's a sign that I'm busy. The non-busy was the person just sitting there, not really doing anything, or perhaps like reading a magazine, something like leisure. And so that was the cue that, oh, that's okay to approach and ask for attention there. And then these data simply show that when we were able to teach the person to attend to these busy versus non-busy cues there. These data, the different data paths are the closed circles are when they engage in the functional communication response during the non-busy times, right? Like when they should be. And then the open circles are those functional communication times when we're busy. So they shouldn't be engaging. They shouldn't be interrupting us there. And what you see is that eventually they learned to primarily ask or engage in that functional communication response when we were not busy versus leaving us alone when we were busy, which is exactly what we want there. Right. And so this, I think, lends itself well because it doesn't rely upon us using like a red card and a green card or these lanyards, which they get lost. They're not always the most practical thing. And so by teaching them to attend to naturally occurring cues of busy and non-busy, that might help with generalization and just long-term outcomes there. Okay. All right. So I mentioned that the multiple schedule is one way to thin that reinforcement schedule. The other way to thin that reinforcement schedule is what we refer to as a chained schedule. All right. Chain schedule, technically speaking, it's a compound schedule in which the reinforcer is produced by the completion of one component of the schedule, and that results in the second component of the schedule being present. What that basically means is that they have to do something first, and then they can engage in the functional communication response, right? So they have to do something first, and then we will provide then they can engage in that functional communication response. So for example, they have to do some work first. Once they've completed that work, then they can ask for a break and they'll get that break. So in that, the video of that first boy, we used a chained schedule, right? So he had to complete 10 different school tasks before he could ask for a break by handing over that picture card there. All right. And so you can see that the chain schedule can be very, very useful in like the classroom, the school setting, right? Where when they go to school, they can't always escape schoolwork, right? So they can't always ask to take a break, or they can't always ask for help. They have to do some work before they can take a break there. Yeah, this is that video there. All right. And so this study was published back in 1995 by Joe Lally and his colleagues demonstrated that use of that chain schedule for escape maintain behavior, problem behavior. So for problem behaviors that were caused by escape from demands, they used that chain schedule to thin that functional communication response schedule there. And so what they did is they gradually increased the number of tasks that the participant had to complete before they could take a break from the activity there, okay? And then this particular graph, just kind of orient over here, shows you how they gradually increase the amount of work, like we did in that video that I showed you earlier today. And so they started with initially, at the very beginning of this, whenever they asked for a break, they always got the break, right? So again, we do that because we want them to engage in that functional communication response. We want to get that going. But now once we start that thinning, they have to then do one demand, right? That's the FR1. Once they complete one demand, they can then use the FC response to get a break. They gradually bump that up to 2 demands, 4 demands, 8 demands, and then the final goal was 16 demands. So by the end of this, they had to complete 16 demands or tasks before they could ask for a break but through that functional communication response. All right. So this is a wonderful example of how we use chain schedules to thin that reinforcement schedule. Now, there are a couple different other ways to thin the reinforcement schedule, but I don't really like them. One is what we refer to as a response restriction, where we take away their ability to communicate there. So this would be like if they're using picture cards, we take away the picture cards, so then they can't communicate there. Ethically, it's a little concerning because you're basically taking away their voice, right? So if someone talks, you wouldn't cover their mouth, but essentially what you're doing is by taking away their picture card, you're covering their mouth. So the whole response restriction, ethically, I think it's a little questionable. The other is delayed reinforcement, which again, I wouldn't use. It's, they engage in the functional communication response, so they ask for attention, but then they have to wait some period of time to get attention. And that doesn't really make sense because, why would you want them to ask for attention and then tell them you can't, you have to wait, 5 minutes for that there. It just doesn't make sense. And you're also likely to, decrease the communication, the FC response that way. So I wouldn't do those forms there. So in terms of the schedule thinning, what's the best way? Again, my answer is it depends, right? So reinforcement thinning is, very, very important. It's probably one of the most complicated parts of functional communication training, right? Because it's a balance of trying to figure out how are we going to thin that schedule so that they continue to engage in that functional communication response and they continue to have low rates of problem behaviors. If you don't do it right, they may stop engaging in the functional communication and they may start engaging in the problem behaviors again there, okay? But there are, if we look to the research, is there an answer in the research as to, what the best method of schedule thinning is? This study by Greer and his colleagues, they summarized the results of 25 consecutive applications of FCT in their clinic using, that multiple schedule and the chain schedule. And what they found is that FCT schedule thinning was effective in reducing, access to reinforcement and maintaining low rates of problem behaviors, regardless of which procedure you use. So both procedures were effective in maintaining the high rates of functional communication training and the low rates of problem behaviors there, right? So they weren't able to figure out which one was better than the other. Both are effective given their particular circumstances. This other study over here by Davis and her colleagues, they conducted a systematic review of research studies that incorporated FCT schedule thinning, and they identified 82 articles. And what they found is that, that the multiple schedule was the most commonly used, at least in research there. And it was more commonly used for behaviors maintained by positive reinforcement, like attention, whereas with that chained schedule, it was more commonly used for behaviors maintained by negative reinforcement, like escape from demands there, which makes sense. All right, so going back to that question of, which one's the best method of schedule thinning, again, it depends on the individual, the context, and your environment. But what we do know is that the function of the behavior, the cause of the behavior, might be an important variable when deciding which way to thin that schedule. So again, if the behavior is maintained by positive reinforcement, such as that attention or access to tangible items or preferred items, the multiple schedule might be the best way to go, right? Because you're basically teaching them there are some times where you can get the attention and there's some times when you cannot. Whereas for behaviors maintained by negative reinforcement, that escape maintained behavior, then the chained schedules might be better because you don't want them to always escape doing schoolwork, right? They have to learn, you have to go to work. And so chain schedules will gradually require that they go to school, they do schoolwork, they go to work on a very gradual basis before they can take a break there. Okay, so I think these are two things to consider. So I know I'm running out of time over here, but functional communication training, again, is one of the best evidence-based approaches to treating complex problem behaviors, and it's something that I am more likely to use in terms of treatments there. We know from clinically speaking as well as research that is very effective in reducing these problem behaviors. And it's also a wonderful treatment option because it teaches them something very important there. There are lots of treatments that we use that don't really focus on teaching new skills, but functional communication training requires that we teach them a really important new skill of functional communication training. And that's something that's very, very beneficial there. Although it is a very powerful treatment, there are many considerations when using functional communication training. As I've talked about today, we need to take into consideration, how we go about teaching the functional communication response. Hopefully, you're just using the strategies that you would normally use in your particular settings there. We also need to, understand or try to figure out what type of functional communication response to use. Right? There's no easy answer to that. And then finally, how do we make it easier for caregivers to use? So by fitting that reinforcement schedule, again, there's no one right answer, but there are some variables to consider when we're deciding what to use there. Thank you very much. All right.